In this video, we will be demonstrating a PA axial oblique, RPO and LPO cervical spine. The LPO should be performed with the patient standing or steed with 45 degrees body rotation. AES 7 to source to image distance is recommended. And the part position is rotate body to 45 degrees with side of interest further from IR. Have patient extension slightly while looking forward. Center spine to IR. Center IR to C4. Shield connects and take both oblique projection and respiration is suspended. The central ray is angulation 15 to 20 degrees cephalad entering C4, and as I said before, 72 inches source to image distance is recommended. And the collimation is adjusted to 10 times 12 inches and place side marker in the collimated exposure field. In the end, the required volatility for taking this exposure is 85. The next technique of cervical vertebra is PA axial oblique, RIO and LIO, and it's ideal for the patient to be upright or supine. (45 degrees body rotation with side of interest closer to IR. Extended chin slightly. Center spine to IR. Center IR to C5. Shield connects and take both oblique projection and 15 to 20. Angulation degrees cut at entering C4 and 16 to 72 inches source to image distance is recommended. Actually it's central array. And the respiration is suspended and the collimation is adjusted to 10 times 12 inches. Place side marker. And the collimated exposure fit and in the and the required voltage to take this exposure is 85.